Hi guys, my name is Addison Henson and I'm currently in an anatomy and physiology class. I'm in the second part, and for one of our lab modules we learned about urinalysis. This was a very interesting topic, and I feel like this is something you kind of need to learn for your everyday life. Obviously we all deal with this, and it's important to know the colors and the reasonings behind all of this stuff, so I try to put this in a very simple way to help understand. I included some visual representation at the end, and so I hope you guys enjoyed this project, and I hope you get a better understanding of what this is, and hopefully this helps you. So, to give a little introduction, urinalysis is a diagnostic test that examines the physical, chemical, and microscopic properties of urine. It is used to access overall health, diagnose medical conditions, and monitor disease progress. Key components of urinalysis include physical examination. This evaluates the color, clarity, and odor of the urine. Number two, chemical analysis, which tests for substance like glucose, protein, ketones, bilirubin, and pH levels using reagent strips. And microscopic examination analyzes urine sediment to detect cells, bacteria, crystals, and other particles. Urinalysis can be helped to diagnose conditions such as urinary tract infections, diabetes, kidney disease, and other metabolic disorders. First, for the physical examination, number one, the color. The color of the urine can provide clues about hydration status and potential health issues. Normal urine ranges from a pale yellow to a deep amber. Dark or unusual colored urine may indicate dehydration, liver problems, or presence of certain medications or foods. Clarity: normal urine should be clear or slightly cloudy. Cloudy urine can suggest the presence of bacteria, pus, or other substance, which might indicate an infection or other conditions. Number three, odor. Urine typically has a mild odor. A strong or unusual odor might indicate a urinary tract infection, metabolic disorders, or certain foods or medications. So next, to go over a procedural overview. To perform a urinalysis in a laboratory setting, begin by collecting a fresh urine sample using a sterile container, then label it with the patient's details. After preparation, gently swirl the sample to mix, centrifuge if needed to separate the sediment from the supernatant. Conduct the physical examination by noting the color, clarity, and odor of the urine. For chemical analysis, dip a reagent strip into the sample, wait for the specified time, and compare the results of a color chart to assess various substances like glucose, protein, and pH. Next, prepare a slide with the urine sediment for a microscopic examination, checking for red and white blood cells, bacteria, crystals, and other elements. Document and interpret the findings, then record the results in the patient's medical records. Finally, dispose of used materials according to the safety protocols, clean the work area, and consult with healthcare providers if abnormalities are detected. For my next slide, I put common abnormal urinalysis results and their possible meanings. I put a few, and you can look over them, and these results help diagnose and monitor various health conditions. The more common ones are at the top, and then I kind of put some that aren't as seen, but they're still around, and these are very important when it comes to interpreting results. Next, I'll be talking about how you can use this in clinical applications. So, a urinalysis is a valuable tool in diagnosing several conditions. Diabetes: urinalysis detects glucose and ketones in the urine, which can indicate uncontrolled diabetes. High levels of glucose suggest that blood sugar levels are not well managed, while ketones may indicate diabetic ketoacids. So, kidney infections: the presence of white blood cells and bacteria in the urine can indicate kidney infection, such as polyphysitis, petunia, and hematura, and can suggest kidney damage or inflammation. Urinary tract infections like UTIs. The leucites in the urine are common indicators of UTIs. The presence of bacteria and elevated white blood cells further support the diagnostics of infection in the urinary tract. These findings help guide further diagnostic tests and treatment plans, ensuring appropriate management of these conditions. So in a lab setting, when we worked on this, this was a really helpful template to kind of help us understand it more. And I feel like when you can see it with visuals, you have a better time understanding it. So first, for the background, a diagnostic tool for health assessments, often done in individuals with urinary symptoms, painful urination, frequency, urgency, lower abdominal pain, pregnant women, individuals to determine asymptomatic bacteria, indications: diabetes, liver disease, renal disease, drug testing, urological cancer screenings, electrolyte hormone levels, and pregnancy tests. I'm sure you've done one at the doctor before where they give you a little clear cup. You go in and do it just so they can double check. This is really common when you do go to a pediatrician. I remember doing this when I was a little kid. Every time I went to the doctor, they test for urine pH, specific gravity, blood, proteins, glucose, ketones, white blood cells, neurites, bilirubin, urobilirubin, and microscope examination, red or white blood cells, urinary casts, microorganisms, and crystals. So these are animated vials of urine samples that show you the color and what they represent. So as you can see for the first one, we have a very clear, this is a very good sample. This means you're hydrated, you're drinking lots of water. This is a really good color to have. Next, we kind of see a little hint of yellow. This is still good. This just means you're not drinking as much water, but it's not super clear. As we get into these two darker shades of yellow, we see that they're fair and lightly dehydrated. This means you definitely need to drink more water before it gets too bad. As we see this orange color, that means it's really dehydrated and that you definitely need to drink some more water. And then the two on the end that are slightly brown, this is also not a very good indication of drinking water. This means you are severely dehydrated and you definitely need to up your water intake. Just because your pee might have a little yellow in it doesn't necessarily mean you're dehydrated. It just means you're not drinking as much water as you should. So you need to make sure you're always staying on top of your water intake for whatever your body weight is. I try to drink at least like 4 to 5 bottles of water a day, and this keeps me at a good urine color balance, and it makes me know that I'm not dehydrated. I'm getting plenty of water intake, and this can be a big sign of different things, not just dehydration. Okay, next, this is something you'll also see in urinalysis, pretty common. So what this is a pH indicator. As you can see, she has a little test strip. This is what gets sticked into the urine sample and then out, and then they put it on the chart to kind of compare to see where the pH is at. They usually do this after 60 seconds. They can also do this with blood in urine, but this example that I put up here, this is a pH one. So as you can see it on the scale right there. I want to thank you all for watching this presentation. I hope you found it helpful. I hope it helps you during any A&P class, or if you're even just trying to learn more about your analysis and trying to figure out what it is in a simple way. I try to explain everything in a very simple way. That way it's easier to understand. This really helped me with grasping the concept, and especially looking at the diagrams and the visual representations will really help. And I hope you found this helpful, and thank you for watching.